Well, welcome everyone to the critical updates for general practice webinar with the Avant Practice Solutions and Avant Law team today. It's great to have you with us, and congratulations on putting aside the time to work on your practice and get some updates at a sort of one of those times of the year when there's a bit of change going on. I'm David Williams. I am a neurologist and a practice owner and also general manager of Avant Practice Solutions, and really pleased to be able to bring the team together this afternoon. I'd like to start by acknowledging the country from which I'm bringing this webinar to you from. It's the Boonwurrung country, which is part of the Kulin Nation, and I pay my respect to the elders past, present and emerging, and welcome you all from other parts of this great land. So now's the time to really get started. I'd like to introduce our panel who are going to be bringing their perspectives. And the Avant team is really about supporting doctors and medical practices in many more ways than just insurance and indemnity. And what better way to start off today's session than to have Anna-Maria Gibb, who is really the founder of the PracticeHub platform and a product adoption manager in our Avant Practice Solutions team. She's an expert in the governance and running of general practices, and with a great deal of practice management experience, she's going to give us some insights into the MyMedicare rollout. Ben Ryan is one of our senior associates in the Avant Law team. Avant Law provides legal services for commercial enterprises in the sense of supporting general practices, and he's going to give us some insights into the payroll tax issues, shall we say, that have come up over the last couple of years. And Sav Russo is an associate at Avant Law with a great deal of experience around the HR requirements. And we're going to touch on a few pertinent matters for this time of the year. So I hope that you enjoy the presentation and feel free to ask questions. Anna-Maria, it'd be great to have you tell us a little bit about MyMedicare. Over to you.
Fantastic. Thanks, David, and welcome everyone. Thank you, as David said, for making the time to join us. So I'm going to spend a few minutes talking about the MyMedicare rollout, and really what we're going to focus on is how to operationalize that in your practice. So what we're not going to cover is things like how to register your organisation. That's something that most of you have had a few months to work through or have been able to do for some time. So we're not going to cover that. We're not going to talk either about some of the items that have not yet been released. So one thing that is really apparent with MyMedicare is that this is a program that is starting with several items and is going to be built on over time. So we'll focus on what we know now, but also really, as I said, it's more about how you're going to operationalize this process or this program now and into the future so that you can effectively run it in your organization. All right, so a quick reminder of what is MyMedicare. It's a voluntary patient registration system. It's about formalising the relationship between the patients, the practice and their practitioner and other primary care teams as well. And it also comes with new funding packages. The benefits to your practice, I guess when I thought about this, I thought they're also the benefits to the patients as well. So it's important to sort of think about the patient-centered care, they're getting consistent care, the practitioner, the patients are linked to your practice. And there's also those benefits with those increased incentives and the longer Medicare item numbers for telehealth as well. Just having a look at the Know Your Cohort is probably the first thing that I would really suggest that you focus on. Who's eligible and who is actually going to benefit from being part of this program in your practice or registering with your practice, not just now, but also into the future. Now, there's some pretty basic eligibility criteria, things like the 2 face-to-face visits in the past 2 years. Beyond that, though, I think it's not just about the eligibility. I think it's also worth thinking about what works for your practice, both financially and practically as well. And, you know, you've got a finite capacity to sort of see patients, and it's important to sort of think about if there's increased demand, how will you manage that? And you need to plan how to successfully integrate and resource these new processes into your systems. So things like appointment management, staffing levels for both the admin team and the practitioners and the rest of the clinical team as well. Now, part of this process, I think it's really important to work out the easiest and most effective way to extract information about those patients that are eligible. So products such as Cubico and some other ones as well, your practice management software will allow you to do that. And I think, the more you can kind of think through who do you want to target and how can you extract that information and then integrate the processes, the easier it will be for you to integrate this into your practice. One of the things I suspect is happening or will happen is that your patients are going to come to you. There'll be a lot of media. There's been a lot of discussion around what is MyMedicare. I think you're going to find a lot of the patients are going to come to you for information. You're their healthcare provider. They trust you and they value your opinion. So you'll need to ensure that you can explain the benefits to them and that everyone in the team is explaining this consistently and clearly to them. So knowing what those benefits are and then targeting the patients, explaining to them what's the benefit and why they should register, I think is going to be really important. When it comes to operationalizing, a few tips here. First of all, I strongly recommend, well, as David in particular mentioned, being sort of a founder of PracticeHub, document is probably my catch cry here, is if you document these processes, there's a better chance that they will be followed consistently. Use consistent language. Don't reinvent the wheel. I recently saw on LinkedIn, I saw a post from a practice basically saying, hey, you can register with us. We're enrolled or registered for MyMedicare. And the language they used was essentially all the language that is in the Department of Health information, all of the resources that are out there. They've simply used that same language and used it as what are the benefits to the patients for their patients registering with their practice. So I think, that's something to think about. Again, making sure the whole team is using consistent language. So maybe a bit of role playing during a practice meeting. We've got a 65-year-old patient from a non-English speaking background who has diabetes. How would we explain the value of MyMedicare to that patient? Why would they want to register? So having some scenarios around how do you position this for different types of patients, particularly based on your demographics, I think is really valuable.
I'll just jump in there because I think it's what you've taken us through is a description of how MyMedicare works and the consistency and importance of being planning for this. In a brief sentence or two, give us an idea about what the minimum planning a practice manager or practice owner should do for this, because it sounds like there's a bit of project work. So time has to be set aside for this. There's financial benefits from it. There's systemic benefits. How much time do you reckon it takes to be able to develop a plan, get the team going and document it so you can make the benefits from it?
Yeah, David, I think, like you say, there's different components. I think if you're looking at the financial aspect, you'd probably need to do look at your current billings around how much telehealth are you doing, how often would you, how many longer telehealth appointments. So doing some sort of cost benefit analysis for that, I think that's probably, and again, with some of the software that's out there, it's actually not that difficult and not terribly manual anymore. So it could be a reasonably quick process. But I think the aspect around documenting and training your team, those are the parts will probably take a little bit longer because you need to be clear about how are we going to do this, what is the role of the various people in the team, and making sure everyone is trained. So I don't know, I can't give you a clear answer, but I suspect, a good few hours would be for the practice manager in particular to feel really comfortable that they understand what is involved and how to maximize the benefits for both the practice and the patient. That is really the goal of this.
This is a talk that's supported by Avant Practice Solutions. And in terms of supporting the practices in our ecosystems, what are the tools that make it easier to roll out this sort of change management that Avant Practice Solutions have?
So I think probably obviously a platform like PracticeHub, which allows you to document processes, quickly update them, communicate and share them to your team is a really good way of doing that. And that's the same for any kind of documented policies and procedures. But I also think, the knowledge of the practice management consulting team to tap into that and to really sort of get some support with that, it certainly will make that whole setting up this integration and these processes in your organisation a whole lot more more, probably quicker and more effective as well, more comprehensive. So as you can see, as I was saying, things like planning and documenting and training will actually reduce the stress. I feel like I've seen a lot of commentary in social media, and I feel like there's a lot of stress being created in practices with change and this change and what does it mean and how do we implement it. The more you can kind of think through the process, document it, make sure everyone's trained appropriately, will certainly reduce the stress, both initially and going into the future, because as this program changes, which we know it is, they've already flagged that, it's easier to adjust existing processes to meet new changes than it is to start from scratch or to have nothing in place and to keep starting over and over every time. Probably a couple of other little things I would mention is again, if you've got agendas, if you've got agenda items, make this a standing item on your meeting agendas so that every month or quarter, however often you meet, start thinking about, let's discuss what's working, what could work better, so that everyone is constantly thinking, this is a process we need to successfully embed. How can we make sure that we're doing that effectively as well? Of course, the other aspect of this is helping your patients to register, and depending on your demographics of your practice, it will depend how much sort of assistance patients might require, but you can start with really simple things like having posters in your waiting room with QR codes that patients can scan. Those who've got the apps and that on their phones can register very easily. Some patients may prefer to do a form. I believe some of the practice management software now allows you to print out the registration form pre-populated with the patient information. So again, saving you and the patient time, making the process a lot smoother. So having a think about how can you assist the patients to register that want to as well, I think is a really valuable aspect of what you need to consider through this process as well. So lastly, there is no end of resources, and I'm a little bit torn between, are there too many resources, to be honest, because when you start looking, there's an awful lot of stuff out there. But I think probably the key thing is go to trusted sources. So the Department of Health and Aged Care has got some really good resources, toolkits, brochures, posters. Again, as I said, putting posters up in the practice, FAQs, fact sheets, the registration forms. And again, if you were using a product like PracticeHub, you would be able to put links to all these resources in your documentation, and those links would automatically update and keep going. So as the department updates those resources, you'd be always accessing the most current version. Again, things like that, where you can use automation, it will really save you time and ensure you're accessing the most current information. Other good sources of information, the RECGP has got some webinar recordings that they have available. Your PHNs, I think, are really good because they're focused on locally based support. So what they're doing for your organisations, your practices in your particular area. And I mentioned Cubico, and there's other data extraction tools, making good use of those in terms of being able to target the patients that you want to target for this process is very important. So, David, that's probably the main sort of highlights for MyMedicare at this stage. And really, I think everyone was a bit initially overwhelmed with the whole registration process. And now the ball's kind of on the side of the patient's side of the fence. And it really is about how do we bring this all together.
Yeah, and there's perhaps not the level of incentives that we'd like to see for a program like this, but we are told that it's foundational to some of the longer term changes around Medicare and setting up general practice. So the modern practice should be able to cope with this change in anticipation of further changes down the track. I see a nice question which demonstrates the outliers in this sort of program that Victoria McCartney put onto the chat about 2 geographically separate practices across 2 rural towns, 30 minutes apart. And not surprisingly, patients will switch between the different practices, even though they roll one single best practice instance. I'm not sure, Victoria, we're at a state to be able to dive into those sort of outlying questions at the moment. It's acknowledged that there's scenarios which don't naturally suit the normal flow. I think, Anna-Maria, it's probably best to either take that offline with some of our practice management support through Avant Practice Solutions to look at those outliers, because we're aware there's many scenarios, just like you've described there, which probably the Department of Health don't have a great answer for yet either.
I think that's going to be really apparent over time, that there are these sort of outlier situations as well.
Now, and that leads nicely to your next slide, which we've kind of touched on already, but the practice management consulting team and PracticeHub carry these resources, and many people on this platform, on this webinar, are already experienced PracticeHub users and may have used the practice management consulting team. And they provide services that are short-term or long-term capability and capacity filling for practices. So feel free to follow their resources on that. Look, next, we're touching on a subject which Ben Ryan's been right at the middle of over the last couple of years. It's a space that is really interesting because there's lots of different commentary, and the wheels of change are certainly in motion here. As a practice owner myself, it is difficult to stay on top of it, and I'm quite pleased to say that I'm a client of Ben's who's helped my practice come to terms with this. So here for an update at the start of December 2024, slightly different update than December 2023. Sorry, 2020, last year anyway. Ben, over to you. I'm sure you get the stats better than me. Take us through it.
No, hopefully it's going to be a much better year than it was last year for everyone, as I think all of the Christmas presents from the relevant state revenue officers have hopefully been dropped for the year, and we can just actually have a bit of consistency now moving forward. That would be very nice, certainly, and I think everyone would be very happy if that was the case. So really what we're looking at today is, there hasn't been too much shift in the last couple of weeks from a payroll tax perspective around Australia. Fortunately, and touch wood, most of the uncertainty has now been clarified by the various revenue officers. I know that AGPA and the RACGP and a few of the other bodies are still meeting with relevant state revenue officers to try and get some more certainty and some more clarity for everyone. And that's very much happening in the background for almost every state, I believe. So it's still very much a work in progress, but hopefully more so a work in progress of let's get some more clarity around exactly what we should be doing rather than what we shouldn't be doing. A lot of the misconceptions that we've heard over the last few months in particular are up on the screen. The one probably that we're getting the most concern from people is that it's just going to be too hard to have the doctors being paid directly, and that's going to just result in you rocking catatonically in the corner. And as David said, he doesn't look as though he's rocking catatonically in the corner. He's still got all his hair. He hasn't pulled it out from the shock and the pain of making sure that the doctors are still being paid directly by their patients. So it can be done. And the honest feedback that we've had from almost every client that does have a system where the patients are paying the doctors directly is that it actually is an easier process to administer on a day-to-day basis once you actually do get through that rigmarole of making the shift across and straightening things out. So I'm not going to say it's not a bit of a challenge to get it over the line at the initial point, but certainly it's a much better way to be operating, and it will reduce your risk significantly. So payroll tax around Australia is a bit of a brief snapshot of what every state and territory has. Really what we're looking at is relative consistency. Most of the amnesty or the relief around Australia has been announced, and I suspect won't be changing anytime soon. Hopefully Victoria comes to the party at least a little bit, but very much a wait and see. Certainly, when we're looking at what a services and facilities agreement should look like, really the fundamentals are up on that screen. And the main aspect really is a case of we want to make sure that your agreement is as clear as humanly possible, that the doctors are engaging your practice to provide you, or to provide them, I should say, with services and facilities that effectively they can get the economy of scale from you. So when you take back a facilities and services agreement and a practice to what it should have been, and what most people always say it has been, it's a case of a group of doctors getting together saying, well, I can get my own space, I can hire my own staff, I can get my own practice management system and everything else, but that's going to cost me significantly. If we all pull together, we can pay a percentage of our billings to cover these costs, and no one has to worry about it too much. That's really what a service and facility agreement is at its core. And so that's what we're trying to make sure is very clear of. The doctors are paying that percentage or that amount to your practice so that they don't have to go off and get their own staff and space and consumables and so on and so forth. So if you have certain things in your service agreement that deviate from the status quo, understandably, this is then a risk to your practice. Hopefully, everyone over the course of the last year or so has had a chance to sit down with their accountants and their lawyers. I would say and emphasize that there is a significant difference between accountants and lawyers that deal exclusively with medical practitioners and those that dabble in it. This is a really technical space, and certainly there's only a handful of decent law firms and accounting firms around Australia that do actually understand the space. At the end of tonight's presentation, there is a slide with a QR code. You're all welcome to scan it, and it will give you a ability to have a one-on-one consult with the Avant Law team, where we can have a chat about your service agreement and just give you that peace of mind. And that's a free, no obligation consult that we offer, just so that you can all have that peace of mind. Because really, the last thing we want for you all is to be tossing and turning at night, not knowing if you have a risk and an exposure. It's much better to know. We'll rip that Band-Aid off, and not only rip it off, but then help you actually fix any of those problems that are there.
Ben, that's really good advice. I know that a lot of practice owners have had, and practice managers have had sleepless nights over the last couple of years. You mentioned the other day when we were talking your preferred vernacular for talking about doctors and contractors and so on. Just so we can get into the habit of seeing and feeling this in real life, what's your preferred way we should be speaking about doctors that are working at a group GP practice?
Yeah, look, I mean, everyone's always very keen to try and find the terminology. I've seen tenant doctors floated around. I've seen, practitioners and various other things. It should really just be a case of they're the doctors, they're the practitioners. Let's not get too creative with it. If you want to call them independent practitioners, that's probably okay. But please don't call them your contractors or your contracted doctors, because as soon as you do that, the little ears and the revenue officers will prick up. And they'll go, well, if you're calling them contractors, are you the principal in a contractor relationship and you're engaging those people as your contractors for you? So no, I would always do emphasize with everyone, please don't call them your contractors or your contractor doctors. Keep it simple. They're your doctors. Well, they're not your doctors. Gosh, don't say that. They're the doctors or the practitioners, and you're the services provider.
And I think another way to emphasize that and bring it into real life as a team leader, if you're the practice manager or practice owner, to work with the administration staff and remind them who the clients are. So the clients really are the doctors. So as an admin team, we're servicing the doctors because they're buying services from us. That does help some organizational parts of administration as well to carry that thought. But also it emphasizes the need to work with the doctors for healthcare delivery and therefore, servicing the patients with the love and care that we'd expect from our best admin teams. So I find that helpful as well.
Yeah. And I think even on the basis of, that's perfect segue to websites even that people need to be reviewing as part of this process. Making it clear that it's not the doctors that form part of your team. A lot of the time, everyone has their websites that have our team and the doctors are on there. I'm not saying get rid of our team and emphasizing the point that your admin and your support team are fantastic at what they do, but you really need to be emphasizing that your team is in the business of supporting the doctors so that they can provide the exceptional care that they provide to their patients. And it's not a matter of the lawyers getting involved and ending up with these big waffly explanations of independent doctors who engage the practice to provide services and so on and so forth. If we're doing that, the lawyers have won and there's no semblance of marketing or anything else like that. So we want to avoid that if we can. But yeah, really making sure that it's, an emphasis on the practice is supporting the doctors so that they can provide the care to their patients. And if you're doing that, then you're hopefully ticking all the right boxes. So when we're talking about payroll tax, it's very easy to get caught up in, relevant contracts and potentially thinking that it somehow implies or infers an employment relationship. We've had a few people over the last year or so in particular saying, well, if they're going to be a relevant contract and we're going to have to pay payroll tax, why don't we just make them all employees now? I probably wouldn't do that. And certainly Sav is going to say, I'm sure all of the other reasons why you don't want to do it will pull me up if I say anything wrong. But really, it's a case of if you transition them all into employees, you're going to trigger all sorts of historical leave entitlements and superannuation and so on and so forth. Similarly, if you start dealing with them as, independent contractors, that may enliven some superannuation entitlements potentially, particularly if you say that's the way that you've always meant to be dealing with them. So do keep in perspective of if you come to us and say, well, we provide the service to the doctors, we bend over backward to accommodate their needs, we don't roster them on, they tell us when they want to work and how they work, and we just have to make the facility and the service available to them, then that's, Facilities and Services Agreement 101. So let's make sure that's what your agreements actually say. Now, the benefit of payroll tax is that most of Australia is relatively consistent in the application. So in Queensland and New South Wales and Victoria in particular, we can cross-refer and see what other people are doing and make sure that we're ticking all the right boxes, particularly when that comes to exemptions and what sort of practitioners are exempt for the purpose of payroll tax. It's almost as if I wrote the slides myself. There's the perfect segue there to, are there any immediate exemptions? Why, yes, there are. And there are three in particular. The one that we see most commonly for specialists and some general practitioners is the 90-day rule, which is effectively if you have a practitioner that's engaging your services for less than 90 days each financial year. It's not consecutively, and importantly, if it's an hour a day that they're engaging you, that hour will still count toward 1 day. And you do need to make sure that you're keeping records of when those practitioners are working in your practice and engaging you to provide them with a service, so that if you do need to evidence it to the Revenue Office, you can. Providing services to the public generally is always a bit tricky because we don't have too much certainty in relation to what levels you have to actually satisfy for that. It's a relatively sort of accepted standard that if you have a practitioner that's working 3 days in a hospital or in another practice that you don't own and 2 days in your practice, that they will satisfy that exemption. Similarly, if you're having two practitioners, potentially a husband and wife duo, that are working under one corporate entity, then that may be services being provided by two or more persons and you would satisfy that third exemption. Relatively long way of saying that not necessarily every single doctor that engages your service is going to be subject to payroll tax. There can be exemptions which you should work through with your accountants and your lawyers. So what is a true service agreement? If you've heard me talk before, you've probably heard me say true service agreement versus a normal service agreement. Really, it's a case of we want to make sure that the way you're conducting yourself in the practice is actually reflected in your agreement. It's all well and good to have an agreement that says we're doing A, B, C, D, and E all correctly. Mr. Revenue Officer, please don't come and audit us. But if your agreement doesn't actually reflect what you're doing in the practice and on the day-to-day basis in person, you are telling the doctors when to work and where to work and having that sort of operational or administrative control over what they do and how they do it, then you may be subject to payroll tax. And if that's not reflective in your service agreement, then it gives the Revenue Office the ability to potentially say that your contract isn't reflective of what you're doing, and they'll seek to effectively strike it out. And so what you'll be left with is just the conduct of the parties. And as I say, if your day-to-day basis is not reflected in that service agreement, then you're potentially creating a significant exposure for yourself. So please do make sure that your agreements are up to date and that you've actually read through them. I know a lot of people that just don't necessarily talk the agreement through with their lawyers and they just go, oh, well, it'll all be fine. I know that the person's drafted it properly. If you don't actually sit down and work through the agreement with your lawyer after it's been drafted and say, this is exactly what we want to be doing, is this what it says in the document, then you're potentially wasting that time and that money because you really need to make sure it is refined and tailored to your exact needs. So what are the key takeaways for the joys of payroll tax? I think the most important one, as I say, is make sure that it's actually in writing, but more so make sure it's signed. I can't tell you the number of times we've had investigations and audits over the last couple of years where we ask practices, can you send us your engagements and your signed agreements? and they just don't have either any signed agreements or only some documents that have been signed. Hopefully you can roll all the agreements out, get them signed, put them in a bottom drawer and never have to worry about them again. But it's really helpful to have that all in a big, nice folder that is easily locatable, particularly if your practice managers change hands. You want to know exactly where that is as the practice owners, because it's such a fundamentally important document that provides you with the protection. So please do make sure that you do get it signed. And as I say, it is one of those instances where you want to make sure that if it's not signed, you're getting it signed and you're sitting down with your lawyers and your accountants to make sure that it reflects exactly what you're doing on a day-to-day basis. If you're not too confident in what your agreement is, or if you just want a second opinion, as I say, please do scan that QR code at the end. Always happy to talk about payroll tax. I've been doing it for the last couple of years pretty consistently. So what's another couple more weeks of payroll tax before Christmas?
Mm-hmm. Thanks so much, Ben. You've been absolutely crystal clear, and the takeaways are really pertinent. And it's really obvious about the investment in getting the right quality information here and advice to progress clearly. Thanks for that update, Ben. We can't honestly get into December without everyone thinking about the summer coming up. For many of us, that's going to be time to take leave. For other people, it's going to be time to cover people on leave. And for probably a number of practice managers and practice owners around the country, it comes with a little bit of a fear of how we're going to keep afloat when people are away, and what if people don't come back into the new year, and how we're going to deal with the holiday rush and so on. So we're going to give you our perspective from Avant Practice Solutions and Avant Law about the critical updates that are relevant at this time of year. When I think about practices operating around Christmas time, I think it's a good time to do a sense check about how resilient the practice is and what actually does it take to keep the management and the business afloat. And this sort of time of year to check over that applies equally during Easter time or during winter when people are going down with colds or flus, or, you know, hopefully not again viral outbreaks from contagions spreading around the world. But basically the test now is to think, what do I need to do to keep my business running, and what is relying to make sure that it operates properly. And right at the top of the list is payroll. There's so many medium and small general practices that rely entirely on one person to run their payroll. And unfortunately, way too many practice managers will take the morning off from their holiday leave to be able to run payroll. And this is it's a worry, because as a practice manager or an administrator, you definitely deserve your holidays. It's something that should come as part of your employment contract. But also, if you're thinking about payroll, then you're not really on leave, and it does leave you in the best position. So one of the weak points in business resilience for a lot of general practice is operationalizing payroll when the practice manager isn't there. The same thing goes for bookkeeping, and perhaps even more so with the changes that have come with the payroll tax requirements. If we're not moving money from the patient to the doctors and moving money around the practice, then it's really easy to get behind on invoicing. It's really disruptive for the doctors that are working around the practice when they're relying on regular updates for their money and reconciliation from the FPOS machines, for example. So bookkeeping often falls to one person inside the practice, and that can be really tested around holiday time. So that's something to sense check again. What's the backup plan for bookkeeping inside the practice? Is it being done at the right standard, or are we causing problems by going on holidays and therefore people are scared to go on holidays? Another part of running a successful business is the financial reporting. I would hope that all practice owners and practice managers are in the habit of reporting the financial situation of the business at least once a month, and bringing that together in a quarterly and annual way, so that actually there can be some sense around the business planning and the business performance from a financial perspective. Now, if someone is away and they're responsible for producing the reports, what's the backup plan for that? How do we get the insights about the performance of the business and making sure that the profit and loss statements and the balance sheets are up to date and accurate? Again, another test to what do you do over the holiday period. And then we also look at the business metrics. So who is making sure that we're actually got the right things set up at the right time? For practices that we help support, we'll often recommend using data analytic tools. Anna-Maria mentioned some before, but basically managing business metrics to make sure the business is on track for keeping all of the staff occupied, the patients managed, and the throughput assured. And particularly during holiday periods when we're either down on staff or bringing in staff, depending on where your practice is, you want to make sure that you're getting best value for money out of those changes in rosters. And that can only be done by surfacing the right business metrics, the sort of the number of patients that have been seen per hour, the room occupancy, the nurse utilization reports, let alone the different billing items that need to be done to optimize your revenue for the practice. This is a bit of a slide to think about testing what are the weak points in your practice and what gets stressed during holidays. The other thing to think about during the holiday period is the team engagement. This is the festive season, and this is a time for end-of-year parties, Christmas parties, other festive parties, and a bit of reflection. Often it's a stressful time of year because there's so many things going on. But as practice managers and practice owners, it's really important to bring the team together to give a sense of community, to support the culture that you're trying to drive inside the practice, and also give a chance for the professionals that are providing the administration support inside your practice and the doctors who are using that administration support to come together and reflect on the year and the achievements of the team. It shouldn't be seen as something that's secondary or at the end of the list of things to do. And an end-of-year celebration is not just about giving presents and drinking as much alcohol as you can. It really should be seen as a time to drive the culture of the business and celebrate the achievements of the team. So I'd encourage anyone who's left that off their planning at the 5th of December to try and nail that on in the next couple of weeks. The fairness of rostering around Christmas time is also important. This does take a longer term view and sometimes does include or require some incitement or support for people to take on a roster that's perhaps not as favorable as someone else's. Really clear communication is important, and dare I say it, as Anna-Maria said a couple of times, documenting the expectations about what we do as a practice to make sure that rostering is fair and make sure that our employment contracts reflect the requirements that we're going to be asked in an operational sense. And of course, front of mind is optimizing the service delivery. So a patient that comes in on a holiday day, if the practice is open, is just as worthy as a patient on a normal day during the rest of the year. That should be part of the culture. And while there can be festive decorations around, obviously the medical needs don't change if someone's turning up to the practice. So focusing on that in the culture and bringing the whole episode of summer holidays and the festive season into also the culture of high quality service delivery. That usually requires some explicit instruction from practice managers and some effort from the practice owners. When many people think about those things, maybe we're going to run short on staff during Christmas time or holiday periods, we're going to actually think about sense checking the business resilience. We find that in fact, there aren't enough resources to be able to have our small admin team of 4 or 5 people do all these things when people are on leave. What we're here to talk about is some other ways to actually support a team that don't involve people taking time off their holidays and so on. And it's quite possible through the new services provided by Practice Solutions to back up your team by outsourcing. So the Avant Practice Solutions team, for example, that do bookkeeping and payroll, work for many practices around Australia, providing a complete outsourced payroll service so it doesn't fall on the hands of the practice manager. And to give an example, a practice manager may well spend 3.5 or 4 hours a fortnight or a month running payroll, and it's possible for an outsourced payroll service to do that in 1 or 2 hours at less of the cost than it costs for the practice manager to do that. It's also possible to have the support of an outsourced administration team from a call overflow virtual reception team, for example, to be able to take the calls for the practice, work inside your tenancy of best practice or medical director or whatever, and actually act like a backup secretarial service that's on the telephones to support inbound phone calls, and a really handy way to support practices that are lean on staff over Christmas time, or practices in holiday areas where there's a surge on requirements of the staff. And I'd encourage everyone to, as Ben said, follow the links and have a look at the different services that Avant Practice Solutions provides in an outsourced way. Of course, keeping the main quality of Avant services, but expanding your team and upsizing the team, in many cases, a lower cost. Sav Russo is an associate in Avant Law who spends a lot of time talking about employment law. And Sav, this time of year, brings up a lot of potential issues and opportunities for practice managers and practice owners to show their excellence in understanding the rights of an employee and facilitating a really great environment. Take us through your updates for this time of year.
Yeah, absolutely. And as you mentioned earlier, David, I think leave is one of the key kind of questions that we tend to get from practices around this time of year, questions around what are the employees' entitlements, can we shut down, those kinds of things. So firstly, today, I just wanted to give a bit of a brief overview of some of the legal considerations to take into account. So firstly, in relation to annual leave, under the National Employment Standards, full-time employees are entitled to 20 days paid annual leave a year. And for part-time employees, that's on a pro rata basis. Now, this is a minimum entitlement that can't be contracted out of. So no matter what your arrangements are with your employees, they are entitled to that leave. Employees must request to take annual leaves. They can't just tell you, oh, I'm off to Europe for 3 months now, off I go, goodbye. And they do have to request, but the employer can only refuse that request where that refusal is reasonable. So that's going to take into account a number of considerations, including what's your capacity like? Has everyone else already put in for their annual leave and you've already accepted that? So those kind of things are going to be really important. The other thing to take into account, and this is something that I think often practices forget about, but where you've got award-covered employees, they may be entitled to annual leave loading when they are taking annual leave in accordance with the terms of the award, unless you do have some kind of effective contractual set-off arrangement for that entitlement. So your award-covered staff for practices is usually going to be your admin and reception staff. They're usually covered by the Health Professionals Award, and the nurses tend to be covered by the Nurses Award. So if you are having award covered staff taking leave, just making sure that you are paying them that leave loading unless you do have some kind of effective set off arrangement in their contracts. Then if you are intending to shut down or close during the holiday period, you can absolutely direct employees to take annual leave during that period. So if you're taking the time off between Christmas and New Year and the practice isn't going to be open, you can direct employees to take annual leave. There are importantly some new procedural requirements under the Health Professionals and the Nurses Award. So you need to notify employees 28 days in advance in writing of the shutdown period. Now, if you haven't already done that, because we're a little bit late to jump on that time frame, you can still direct employees to take that annual leave during the shutdown. You just need to get agreement by the majority of the employees. So if you are in that position, just make sure you're double checking the award provisions and complying with those procedural requirements under the award. If any of your employees don't have enough leave, they've already taken a lovely long break, but you're planning to shut down, that's fine. You can agree with them that they can either take annual leave in advance or leave without pay for the relevant shutdown period. So just dealing with that on a case-by-case basis if you do have any employees in that position. If you are intending to stay open during the holiday period, looking at your rosters, as David mentioned earlier, there are some important legal matters to take into account, particularly if you're intending to remain open on public holidays. So employees do have a right to be absent from work on a public holiday, and employers can't require an employee to work on a public holiday. The employer can request that an employee works, but the employee does have the ability to refuse that request on reasonable business grounds. So it's really important, if you are looking to stay open on public holidays, you're not simply issuing rosters to employees and indicating that they're required to work on those public holidays. You need to make sure that it is a request, and if any employees are refusing, that you're considering, is that a refusal reasonable in the circumstances. Also important to note that if you do have any award covered employees that are working on a public holiday, they will be entitled to penalty rates in accordance with the applicable award. So make sure you're double checking and paying all employees correctly on that front. If you are not requiring employees to work on a public holiday, your full-time and your part-time employees are going to be entitled to be paid as usual if the public holiday falls on a day that they would ordinarily work. So if you've got a part-timer, normal day is Christmas Day is a Monday, and they would normally work on a Monday, practice is closed, that part-timer would be entitled to be paid for that Monday. If they weren't usually rostered to work on a Monday, then they wouldn't be entitled to be paid for that day. So it gets a little bit tricky there with part-timers. For full-timers, it's a little bit more straightforward. Then the next issue I just wanted to touch on, particularly in the context of talking about end of year festivities and hopefully not drinking excessive amounts of alcohol, David. And I'm going to be a bit of a boring lawyer here and put my lawyer hat on. But there have been some recent reforms in this area that's really important that practices are aware of. So from December last year, every business has a positive duty to take reasonable and proportionate measures to eliminate, as far as possible, sex-based discrimination. So that includes sexual harassment, sex discrimination, hostile work environments, which effectively means it's kind of sexual harassment that's not necessarily directed at an individual, but sorts of conversations or things that happen in practice or an office space that may create a work environment that does have some sort of sex-based discrimination. Now, the positive duty importantly applies to all workers. So that includes your employees, your contractors, as well as in this case, your doctors on services and facilities agreements. It's also going to take into account if you've got any volunteers or work experience students, they're all going to be protected by the positive duty. Importantly, from December this year, in a few days or so, on the 12th of December, the Australian Human Rights Commission is going to gain inspection and enforcement powers in relation to the positive duty. So effectively what's going to happen is the AHRC is going to become kind of like what the Fair Work Ombudsman is right now for employee entitlements and minimum wages. They're going to become that for the positive duty. So they're going to be able to go to businesses and ask them to produce documentation and evidence as to what are you doing to comply with the positive duty, and businesses will be required to comply. What's quite interesting for me in relation to the positive duty as a very nerdy lawyer is that the language of the positive duty is very similar to your workplace health and safety obligations. And so you might recognize some of the language in relation to taking measures to eliminate risk. So that's very intentional. And I think it really goes to show that what we're really looking for here and what the Australian Human Rights Commission is going to be looking for is a proactive approach, kind of what we take to workplace health and safety obligations. So it's not really enough for businesses to just react to sex-based discrimination when it happens. We need to be proactive about it. And so I think that's really important in the context of particularly end-of-year functions where you have alcohol involved, and we know that there's much higher risk of sex-based discrimination in that environment, particularly sexual harassment. So there are a few things that we recommend practices do around this time of year in order to make sure they're complying with the positive duty. So the first thing is, based on the guidelines that the AHRC has released, businesses won't be compliant generally with the positive duty unless they do have a comprehensive appropriate workplace behaviour policy. So whether you have PracticeHub and use the policy on PracticeHub, or you have your own policy, that's going to be really, really important. But it's not enough to just have the policy kind of sitting on the shelf or given to the employee on day one and then they never look at it again. It's really important that you're providing regular training as well to your employees. So that might be something that you look into the new year in terms of getting that policy reviewed and giving staff some training around this issue. The next thing, particularly in the context of our end-of-year festivities, is ensuring that when you do your risk assessment of the end-of-year function, make sure it includes a consideration of the positive duty and the risk of any sex-based discrimination that might happen, particularly sexual harassment. Another one is the very classic practice manager or HR manager email to everyone before the end-of-year festivities that kind of gets laughed about at everyone. Everyone kind of chuckles when they send it around, but reminding people of the expected conduct of behaviour at these events is actually really important, as well as ensuring responsible service of alcohol at these kind of functions. Again, sorry to be the boring lawyer, putting a dampener on everyone's fun. The other thing is, if a complaint does arise, and often, we don't see this until the Christmas party or end of year festivity will happen in December, and then it won't be until January, everyone's back in the office, and an employee will knock on your door and come in and spill their guts about something that's happened at the Christmas party. When that does happen, make sure you act promptly and get advice when necessary. These issues are really, really difficult to handle. And we work with practices a lot with these types of issues, particularly around sex-based discrimination. So please, if you do need advice, it's really hard to manage these issues. So get in touch with us. And that is all from me. Thanks, David.
Sav, that's a really good update to get this time of year. It reinforces the importance of taking a proactive approach to management of the business overall, right? It's
Absolutely.
not to be on the back foot. It's understandable, but a little bit scary with the sort of new requirements. But it's not that hard if you spend time doing it. And I'd encourage that the practice managers on the call here and the practice owners set aside time to understand this, go through the resources that we'll share and reach out to get some guidance where it doesn't make sense. Because I think, as a nerdy lawyer would say, Sav, ignorance is not an excuse. And there's plenty of help in the environment for Avant members, for our clients of Avant Law as well. So, yep, a good time to do a bit of a stock take, make sure that we're up to date. And thanks for a really clear presentation on that. While we've got you, Sav, one last question around this. If I have an employee that works 50% of Mondays, so every second Monday, and a public holiday falls on a Monday, does it depend on what my routine roster would be as to whether I get paid for that public holiday or not?
Yeah, so it would depend on whether that Monday is a Monday you'd ordinarily work. So if you kind of do an A-B week system and you normally work a Monday on the week A, then you'd be, and the Christmas falls on the week A, then you'd be entitled to be paid for that day. If it falls on the week B, you generally wouldn't be entitled. But if you do have any employees where there is a bit more of an irregular roster, make sure you get some advice around that. Where the roster is regular, it tends to be much easier.
Yeah. Thanks so much. Well, I think there's been so much clarity. I've really enjoyed the talks this evening. There've been another couple of questions which we won't have time to get to. What we certainly do have, though, is on the next slide, we have a couple of QR codes. Now, these QR codes for Avant Practice Solutions allows you to speak and ask some of your questions. Again, no obligation. It's possible to entirely get a bit of an understanding of what sort of services are outsourced, what sort of accreditation and documentation support we can provide practices, and getting in touch through here, you can book a time and have a chat. And through the QR code here with Avant Law, the team have been in the game for a number of years as Avant Law, but all very experienced lawyers around their special areas of expertise. And with this QR code, you can scan a 15-minute chat with the lawyers to find out, just initial chat to work out some of your questions, some of your positioning, and what it takes to get up to the sort of level that Ben and Sav have been speaking about today. If we've scared you, we don't need to, but what we want to do is be able to support you with the sort of expertise and resources we've got available. I want to thank you all for attending the webinar. We hope you found it helpful and informative. Enjoy your evening. Thanks very much to all the presenters, and have a great Christmas and a safe festive season. See you later.